Hi, my name is Cynthia. I am an occupational therapist with over 25 years of experience. I have decided to create a series of videos to help everyone out there improve their health and wellness. Today, I would like to visit with you a little bit about what you can do if you have experienced a wrist fracture or a distal radius fracture. When you first come out of that cast or brace, a lot of times you still have a lot of swelling. It is stiff, it is painful, and just difficult to move and use. So what can you do about it? First of all, you want to decrease the swelling. So to do that, you can use cold packs. You can do what we call retrograde massage, which is where you start at your fingertips and you work your way up towards your elbow using some firm pressure. You can do this using lotion to help push that extra fluid out. You can do that on both sides. You can even do individual fingers if your fingers are also swollen. Another thing to do is to hold your fist up high and pump your fist, and the muscle action will help to push that swelling out. To help with the stiffness, your fingers might also be stiff, not just your wrist. So we like to do what we call range of motion exercises. You may want to start out just active motion, which is just the muscles doing the motion because they're just really sore to begin with, so you may not be able to tolerate a stretch. I always tell my patients that slow and gentle is going to be far more beneficial than trying to do quick or forceful movements. So for your fingers, what I'm doing right now is just some active motion. If you need a little extra push, you can use your other hand to gently push down into a tighter fist. And this would be active assistive or passive range of motion if your other hand's doing all the work. So you can do that with your fingers, you can do that with your thumb. For your wrist, I just gently push down with my other hand if I'm doing passive. And I just keep working on this until I get the motion better. You may also have stiffness and it's difficult to try and turn your hand over. So you may need to also work on this, what we call pronation supination movement in the forearm. You can use your other hand to help with that as well. You want to watch that your elbow stays next to your side and that you're not compensating by using your whole arm to turn your hand over and not just doing the rotation in the forearm. Once you get past that, you may want to add a little bit of resistance to increase strength. So, a few things that you can do to help with that. You can use a water bottle, which works great. So if you take the water bottle and use it as weight, I would rest my arm over the edge of a table or the arm of a chair, and then you can slowly work on increasing the strength in your wrist this way. I would also do it with my hand turned over. This is kind of hard to do and show it in the video, but also have it resting over the arm of the chair or the table, and do it with your palm up as well. And for that rotation in the forearm, a hammer such as this rubber mallet works very well. You want to keep your elbow next to your side. Let the weight of the hammer pull you over, and then you will work on strengthening those muscles as you bring it back up. So I feel like I should scoot back a little bit. There, now you can see that better, that motion. And it's easy to cheat or compensate by moving your whole arm, so you got to be careful about that your elbow stays right next to your side. If your grip is weak as well, I'm going to scoot back up here, you can use Putty, it could be silly putty, it could be clay. You can use a stress ball to work on improving grip. Clothespins you can wrap a rubber band around the end of a clothespin to make it even harder to pinch and squeeze. Even a washcloth, and just trying to wring a washcloth will work on strengthening that wrist. So these are just a few simple things that you can do to improve the motion and strength in your arm after a wrist fracture. I look forward to sharing some more videos with you. Be sure to subscribe below. Thanks.